Hey guys, welcome to Medifaction. Today we will learn about the anatomy of third ventricle. The third ventricle is one of the four connected ventricles of the ventricular system within the mammalian brain. It is a slit-like cavity formed in the diencephalon between the two thalami. So, in order to learn more about third ventricle, let's start. In this video, I will be enumerating an introduction about third ventricle, communications related to it, recesses, boundaries of third ventricle, and some important clinical anatomy. The third ventricle is a median cleft between the two thalami. Developmentally, it represents the cavity of the diencephalon except for the area in front of the interventricular foramen, which is derived from the median part of the telencephalon. The cavity is lined by ependyma. Communications. Anterosuperiorly on each side, it communicates with the lateral ventricle through the interventricular foramen, also known as foramen of Monro. This foramen is bounded anteriorly by the column of the fornix and posteriorly by the tubercle of the thalamus. Posterior inferiorly in the median plane, it communicates with the fourth ventricle through the cerebral aqueduct. Recesses. Recesses are nothing but extensions of the cavity. These are number 1, right here, the suprapineal. Number 2 is the pineal recess. Number 3 is right here, the infundibular recess. And number 4 is the optic recess right here. Now let's move on to the boundaries of third ventricle. Anterior wall. On anterior wall, number 1, lamina terminalis, right here. Number 2, anterior commissure, which comes right here. And also anterior columns of fornix. It comes right here. The two columns of the fornix diverge, pass downwards and backwards, and sink into the lateral wall of the third ventricle to reach the mammillary body right here. Now let's learn about posterior wall. In posterior wall, number 1 is pineal body. Number 2 is posterior commissure right here, which is in the lower lamina of the pineal stalk. Number 3 is the cerebral aqueduct right here. Roof. It is formed by the ependymal lining the undersurface of the tela choroidea of the third ventricle. The choroid plexus of the third ventricle projects downwards from the roof. At the junction of the roof with the anterior and lateral walls, there are the interventricular foramina. Lateral wall. It is formed by the following. Number 1, medial surface of thalamus in its posterior superior part. Number 2 is hypothalamus in its anterior inferior part. The hypothalamic sulcus. The hypothalamic sulcus can be located right here. The hypothalamic sulcus separates the thalamus from the hypothalamus. The sulcus extends from the interventricular foramen right here to the cerebral aqueduct right here. Flow. It is formed by hypothalamic structures. Number 1 is optic chiasma, right here. Number 2 is tuber cinereum, right here. Number 3 is infundibulum or pituitary stalk, right here. Number 4 is mammillary bodies. Number 5 is posterior perforated substances. Number 6, tegmentum of the midbrain. At the junction of the floor with the anterior wall, there is the optic recess, right here. This is the optic recess. Clinical anatomy. The third ventricle is a narrow space which is easily obstructed by local brain tumors or by developmental defects. The obstruction leads to raised intracranial pressure in adults and hydrocephalus in infants. Tumors in the lower part of the third ventricle give rise to hypothalamic symptoms like diabetes insipidus, obesity, sexual disturbance, disturbance of sleep, hyperglycemia, and glycosuria. Number 3. The site of obstruction can be found out by CT scan or MRI scans where the third ventricle is seen normally as a narrow vertical midline shadow. Dilation of the third ventricle would indicate obstruction at a lower level, for example, the cerebral aqueduct. If the obstruction is in the third ventricle, both the lateral ventricles are dilated symmetrically. Obstruction at an interventricular foramen causes unilateral dilation of the lateral ventricle of the side. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.